While we're waiting for a couple of others, we're going to get started. And we're going to have a report from each of the breakout groups. We're going to start with the community violence group, then the children or youth group, and then the women group. I'm going to ask each of the people reporting out to introduce themselves to you, especially for the people who are watching by webcast. And I'll start off by saying thanks to the people who have volunteered to report out, and thanks to the people who served as the recorders in each of the group. So, Elizabeth, we'll start with you.
Hi, thanks, Shelley. Elizabeth Ward from Violence Prevention Alliance, Jamaica. We were discussing community violence, and we wanted to make sure that we all understood that it was clearly situated within many of the SDG goals, but especially SDG 16.1. The whole part of community violence, though, really needs to be seen within the spectrum of violence. And it really crosses the whole thing from disorganized, sporadic incidents to highly organized violence. And so therefore, when you're responding to community violence, you have to address all the different types of violence, but within the community. So what we really said was that you need to situate it in three ways: the people involved, the places involved, and their behaviors. So what we can look at, if you want to have a greater impact, you address the people who are most affected, your key offenders. And those that you would find in the bars, those that you would find in the hotspots, those you'd find in the troubled schools, in the troubled families. And then you'd want to also look at the behaviors, where those who are actually drinking alcohol, those who are carrying a weapon, those who are in group involvement and doing group-based activities involving crime and violence. So once you've dealt with the people, the places, and the behaviors, what you need to do is, if you can address the people who are most involved, then you can have the greatest impact. But to do this, while you're looking at these issues, you're looking at their mental health issues, and you're also looking at their resiliency factors. So if you can build up those factors and improve their mental health profiles and their resiliency, it helps improve the community outcomes. All the MGDs, as you implement them, will benefit violence. But also, I think many people in the development arena have to understand that you can't improve some of those MDGs until you deal with the community violence. So violence is often a preventer for that. So we would see that while you're going to be having an impact from goal number 5, where you're looking at violence against women and girls, and you're going to be impacting goal 18 and goal 11. You're going to make sure that your education, your economics, your safety of the communities are all in place. Addressing violence is a community response, requires a community response. And what we have to identify is what is the broadest group of people and coalitions that are culturally and appropriate to the situation and the community in which you're working. Now, these groups can't be too large, and they have to be sustainable, but they have to have a diverse composition according to the needs of the community. There definitely needs to be work between law enforcement and public health. And the people who implement these or lead these groups have to be able to work both with the police and with public health and other key stakeholders. Often the synergies are not there, and it's not only the barrier between the community and the police, but the community and other service providers that break down these effective community responses. You have to be careful that you don't overstep the political actors, and you have to be careful of individuals who steal the spotlight and become the saviors of and run out of steam. One of the issues with community responding to community violence is that you need to understand the difference between the short term, the medium term, and the long term outcomes. Often you need to respond and get some short term gains. You often have to wait for the medium or longer term objectives to come further down the road, or as the other sustainable development goals are able to come in. It's definitely, though, bidirectional. So you have to assess it and be able to capture the fusion that helps you best to achieve their goals. One of the important things along the way is and we discussed, was data, and to use the data, whatever data you have, to guide that process. No matter how bad it is, as you use it, it gets better. And if you can use data from multiple sources that you don't even realize, that, like geography departments on where derelict buildings are and where the bars are located, you can put that data together and share it with the community and with the members of the community intervention group. Once you have the needs of the group met with the best available data, the data improves and gets better, and the providers understand what the users need more. You still have the challenges, though. Many of the information systems are not homogenized, like even within the hospitals, between the hospitals and the police and the juvenile system in some countries. There's no unifier and unique identifier, and they're not able to talk across different platforms. So it makes it more difficult to interpret and respond. But when we do produce and use data sets, how do we produce the language of that data? Look at us with all these victimization surveys. Suppose those victimization surveys, the language changed, and we talked about the decrease in victimization, the number of women that were not affected. You understand? The number of children that now could go out and play safely in their community. Using the same data, but you're providing a different profile and language so that you can do it. And the data, as Shelley would always say, the data needs to communicate with the boots on the ground. Are we making sure that when we're talking our technical data jargon, that it meets the needs of the providers and also of the community members, sharing that data in the right way with the community members? Even in what we were, if you look at the group of girls that we were looking at, them sharing their own data and understanding the data and the issues through different means, even through visual means, you're able to build community coalitions. So in summary, addressing community violence entails tackling multiple forms of violence. Other SDGs provide a longer term framework and are very key in that sustainability of community violence. Community coalitions with data sharing that target the people, places, and behaviors are what we would expect to see the best results with. And effective communication. I think we really have to improve our ability to communicate what we know. And we need to ensure that we get some big wins to maintain the support. And when we do get big wins, that there's a maintenance program, because it goes through cycles. And as it goes down, if we stop supporting the community when the violence reduces, it starts to work up again, especially if the other SDGs are not addressed effectively. Don't
Thank
know.
you. Ellie?
We have a little bit of a tag team here. I'm Valerie Mahomes. We talked about violence against children. I'm just going to provide a really quick overview of the broad topics that we discussed, and Evelyn will talk about the kind of findings and solutions, if you will, if that's the right term, that we discussed. One of the things that the broad themes that we discussed was the complicated relationship between the issues of collective violence and all the other types of violence that we're tasked with looking at in this forum. And what we discussed was that the causes are fairly similar in that we need to look at some of the root causes and the commonalities among the types of violence and action. Often the actors or the perpetrators are the same. Children experience more than one type of violence. So that looking at these causes and the common risk factors is really, really important. And we had a fairly hearty discussion on that, and we talked about the fact that institutionally we might focus on the various typologies of violence for technical, logistical, political, or for funding reasons, but the ability to look at the commonalities might help us to see red flags, to be predictive of when and where violence might occur. Also, a member made a very important point that we can elevate the various types of violence, in particular violence against children, when collective violence occurs. So you may have an incident, a collective violence incident that shines a light on child abuse, or that might shine a light on the intersection of intimate partner violence and children's exposure to violence, or children's reintegration into families as a result of conflict or war. One of the other broad themes that we talked about was the absence of data, and that we needed to push the SDGs to increase data availability to help us get at these intersections and this complexity of collective violence and the various other types of violence. And of course, one of our colleagues said the best way to prevent collective violence is to end child abuse. So having that long-term developmental life course perspective is really, really critical. Looking at social norms, we had a fairly hearty discussion on social norms and values as a lever for change in addressing violence against children, and even cross-cutting the various types of violence. We talked about the fact that the isms are perpetuated often through collective oppression and collective violence. And I'll end with a couple of notes. We talked about what do we need to do, what kind of urgency do we need to have to get everyone involved with this, to pay attention to this, to shine a light on the importance of this. And our discussions kind of focused on the language that we use to describe violence, the euphemisms that we use to describe violence against children, and the language that we use can either sharpen the urgency or take away from that urgency. We talked about the othering of violence, and to the extent that this happens to those other people in those other communities, those other countries, takes away our ownership of that. And so we need to break down those silos and create opportunities for the most vulnerable people to be at the table to contribute to the implementation. And I think I will stop there and turn it over to my able colleague who will talk about our findings.
Thank you, and feel free to join back in. I'm Evelyn Tomaszewski, and I'm with the National Association of Social Workers, and I'm a member of the Forum on Global Violence Prevention. And We talked about how cross-cutting the issue of violence against children is across all the SDGs. And I know later today we'll be hearing from a speaker who will talk probably specifically about specific SDGs. But what we really we talked about is how do we find those salient moments to allow people to engage, and how can or could we use social media as a way of engaging? One of our team members, our group members, talked about his aha moment, and that in a sense came in through the back door to addressing violence and awareness of violence against children. And what are those stories, and how can we help people connect with that everyday transformation that happens every day? Understanding and identifying the impact of social norms and addressing human rights from a collective violence lens. I want to reiterate that we really thought that the SDG that might highlight human rights is really one that's cross-cutting when we look at violence and violence prevention. Building resiliency, I know that was mentioned, the word resiliency, the power of language, and we talked about geography of where interventions occur. And the geography of where those interventions occur is important, and what resiliency means, and clarifying definitions of protective factors. And I wrote a note when Elizabeth was talking as well, because we also talked about resiliency as not necessarily, as someone said, surviving. I'm here despite and of what's happened, and because of what's happened, I am resilient, which is certainly true for many folks, but resiliency is an active and equal part of my community, that it's really that framing of equity. And these purple cards are great, or at least they really help me focus my thoughts, but I can't get to the next one. Here we go. Collective violence is the extreme denial of the SDGs. A quote from one of our members, and we decided that that's quite a profound tagline, and that we really need to find practical strategies to do intervention. So we came up with a couple. We realize that evidence exists, that we need to find it, we need to implement it, we need to integrate it, and we need to build capacity, and we need to sustain it in a way that really is part of the SDGs. It's a critical part of the language. One of the folks referenced this United States Government Action Plan on Children in Adversity, and this actually began our conversation of using the term adversity versus children who are affected by violence. But we looked at this and thought this action plan could certainly be a way of connecting and furthering the SDGs. Somebody suggested perhaps an initiative, a vice presidential initiative to implement the policy and ensure sustainability, or a high-level initiative. And we kind of talked about SDG 10 and 11, which are really not those that are typically, when we think about violence against children, we talked about 10 as reducing inequality within and among countries, perhaps through policy and policy implementation, and then making cities and human settlements inclusive, safe, and resilient. And so this report, thinking about perhaps the Forum on Global Violence Prevention, calling for a review of the implementation of this action plan. Where are we? What more can we do? And kind of reacquainting ourselves with this and using this as an available piece of evidence and how we might implement and sustain. Another was an example that was used from a colleague talking about some work that's done at the World Bank through the city-level interventions, and that implementing policy, again, sustainability through building coalitions at the city level, that making policy change at the country level or across entire regions of the world may be an ideal goal, but that working at the city level and city-level interventions could build sustainability. And then I think I'm going to use the words that my colleague Valerie said, science into action workshops, that maybe we as a forum can think about that science into action. Again, the one plan that we have here. And then Public Law 10995 was brought up once again, and might we call for a review of that, an updating and looking at it from the lens of the SDGs. So thank you. Public Law, I'm going to ask somebody else to finish that sentence. Thank you.
Law 10995 is the law to protect vulnerable children in adversity.
Hello, I'm Siobhan Artis Dickerson. I'm representing my group, which is the Violence Against Women, and sharing with you some of the findings that we discussed. And we were very excited to see that a majority of the STGs actually present an opportunity for us to address violence against women. There were very few, maybe one or two, that we actually did not see a direct connection to addressing violence against women issues. And we really discussed there is a need for the intersectionality of addressing violence against women across various areas and infrastructures. And so we talked about involving those who are working on economic development, those people and organizations working on water and sanitation. These organizations are really important because as we talk about safety, if a woman's not able to go out to get water in a safe area where she may be susceptible for violence, these are areas that are not traditionally thought of as violence against women areas, but they're areas that we should be working together to address this issue, looking at education. We all know the connection with women being educated, and looking at even just safer cities, just overall, so that women feel safe as they're going about just doing where they live, work, and play. And so we really wanted to highlight that it's really important to have folks at the table from across these different sectors discussing this issue, and not just having folks who are working in the health field or who are working in social justice areas. It's important to address these targets in an interdisciplinary fashion, and we gave an example of looking at legal frameworks, whether that be working on laws that need to be enforced, because there may be laws on the books already that protect women, but they're just not being enforced, or that actually may be including the development of laws that actually help for the protection of women. One thing we did notice with the SDGs is that mental health was missing slightly from the targets, but we could see where it could be teased out under very instances where it may be mentioned under non-communicable diseases. And so we think those are areas that we really want to highlight to be able to address the mental health aspect of this topic, that we may need to look at some of these other overarching terms. So mental health may not be directly spelled out, but there are opportunities to address mental health issues and supporting women in this area. We chose to focus for our theme as actually resiliency, and we had a very good conversation about how it's important to really think about how you brand this word, how you brand topics of talking about violence against women in the context of translating the goals to make them culturally and community-wide acceptable. One goal that we focused on was goal 5, and we gave the example of how maybe the words like gender equity and empowerment may not actually resonate very well across cultures and communities around the world, but using other terms that we gave as examples include harmony, building resiliencies to address gender equality and empowerment. So you're using different terms that may not turn off those that you're trying to include in these conversations. And circling back to when we were talking about having multi-sector representation at the table for these discussions. And so you're trying to come up with terms that will be more acceptable across the community to address violence against women. And then looking at different communication styles and thinking about how does language hinder our work to serve women. And so there could be a lot of work done in that area to improve that. And as we were discussing resiliency, we also discussed how mental health plays a role overall in building resiliency and reinforcing resiliency. And so looking at mental health as a subtopic area of this topic of resiliency. And so we really think that there's a lot of opportunities for work to be done in this area, because as communities feel empowered, we're actually creating a culture of good mental health. And so we were really looking at these things in an indirect way, but we wanted to make sure we capture that as we were discussing resiliency. And lastly, we discussed who are our stakeholders. And we really honed in on the fact that our stakeholders that we really want to highlight is that those are people who are invested in the success of our work and our programs. So not just those who are invested in our programs, but those who are invested in the success of the work, because there you will have a long-term commitment in making sure that these programs are effective and they're successful and the strategies that are being implemented will actually work. We gave some examples here in the U.S. The Vice President is very much committed to working on violence against women, and there's actually been a federal interagency work group looking at violence against women across the various agencies, so not just the health department agencies, but looking at Department of Justice, looking at transportation, looking at housing. And so seeing that group come together allows opportunity for multiple groups to come to the table to discuss these issues. And looking at your executive sponsors, they are invested in the work that they are funding, but they're also invested in the success of your programs. Obviously, providers and community partners and implementation partners are other examples. But we recognize that each of us have our own partners, and the types of stakeholders will vary, but we need to think outside of the box of who those stakeholders may be. And they are typically, sometimes you can get a lot done with some of your non-traditional partners. And so we want to make sure we really capture that as we talk about or think about who are the people we need to engage with. I think that covers it for our group.
Now I'll open it up for a brief time to any other members of any of the groups and anyone who has any questions. Any thoughts that should be added? What are you picking up on as the core themes from all three of the groups? I've got some.
So, hi, this is Vicki here from USAid. And I just wanted to highlight that as I heard everybody speak, some themes did resonate for me across the groups. I think I heard us talk about, in some cases, a framework for addressing violence. And so whether that be at the national or drilled down into like regional, local levels, the importance of having a framework that drives us towards our end goal was critical and important. We talked about resilience and how resilience, I think we talked about it in our group in violence against women, and I know that you guys talked about it in violence against children as well. And resilience is more than just the ability to withstand something, but it is that kind of agency and kind of more purposeful and kind of beyond just the abilities to withstand something, but to be empowered as well, and taking a more positive spin on that. And then really just the amazing opportunity that we have through the SDGs to address violence prevention in a multidisciplinary fashion, and that they really do build on each other, and that addressing education, health, economic empowerment, really all, and sustainability of our environment too, really all help create a foundation for a more sustainable world, and therefore less violence in our environments. Thanks.
One of the things I thought was important is that all three of the groups seem to focus on two things, a balance between purpose and process. We tend to focus on one or the other, but all three groups seem to hit on the purpose of why we need to approach these and the process, the way to go about it. And also the need to focus down at the most critical level, the individual, as well as the loftier theme or drivers. And I think that's a pretty important point. To use a phrase that Tom used in one of the workshops, what seems to be emerging is a continuum of response from focusing on the individual, both who's been engaged and from a prevention point of view, all the way up to the global initiatives. And that's pretty interesting. Any other thoughts or comments?
Yeah, I just want to underscore that point. We ended our discussion, as I recall, just on implementation of the SDGs and also on these evidence-based programs. And if it is true that we have programs that we can, that we've vetted, that do have an evidentiary base, and they are available, the question is, how do you get them into the hands of people who need them, communities that need them, and how do you go about implementing it? What does SDG 10 look like in practice? And can we give communities and legislative bodies and so forth, our stakeholders, can we give them a picture, a story, kind of piggybacking on what we heard during lunch, of what this looks like on the ground and in tangible terms? And I think that that's the challenge, and that's the work that's the hardest going forward. That's the boulder to push uphill, because we can talk about the lofty terms, we can wordsmith resilience, we can focus on the language, but still, even in doing that, what does that look like for the legislator who goes to fight for particular policies? What does that look like for the caregiver? What does that look like for the humanitarian worker? And so on and so forth. So I think if we can wrestle with that, I think we will be, helping to really move this agenda forward.
And if I could be so bold, another thing that seems to be a core theme, not even just in the workshops, but in earlier conversation, is that all of us here involved in all our different ways have an obligation to be interpreters. And one thing we have to interpret better is the data. Because as was discussed during lunch between a few of us, if I'm a minister or a community organizer or a police officer on the street or a social worker dealing with victims or trying to prevent people from becoming victims, data, as we know it as researchers, means nothing. Can't use it, don't have any room in my pocket for it. We have to interpret it into a tool that's practical, that I can apply, as I always say, at the boots on the ground level. And that seems to be a big point that people have made all day, and even some of us yesterday in the closed session.
Remember what those police chiefs said? Invest in kids and reduce crime.
Yes, it was a police chiefs group. This was pointed out by someone that said, if you invest in prevention and you invest in children, I think that's it. We can get somewhere.
Reduce crime.
And reduce violence and prevent violence and all the above. But police chiefs aren't saying, give me more data. They're saying, help me use the data that we have access to. And I think that's what we're hearing from a lot of the sectors. Another thing that came up, because we ran out of time and we had to take the break and people kept talking, was that we've talked about, and Tom in the community violence group was very engaged in this, about bringing public health and law enforcement, emergency medicine, some of the sectors together in new ways. But the group that we didn't talk about, I no disrespect to them because I am and some of you are, is academics. And academics do research, sometimes for some very strange purposes, like journal articles. And it never gets into the hands or is written in a way that practitioners can make sense of it. Good data, but the way it's written for a Class A journal, no disrespect, has very little to do with the real world. And what can we do here in the forum to serve as better interpreters?
I think that's such a good point, and I mean, just think of this, I guess, in three segments, because it comes back to what I think one of the things our group said. But so it's taking the data, it's communicating the findings effectively to multiple recipients, different fields, and so on. And then the third thing is, so what do I do about it? What is where do I go next with this? Because when we look now, I think at the brain science and early childhood and all of that, and I mean, Shankov had a brilliant communication team that really made that stuff, run in the minds of the Peruvian head of state, for example, just kind of, no pun intended, mind-blowing. But the question then is, how does that translate into programs? What do I, and that's for the practitioner on the ground. So I think there are really three important tiers here that your point triggers for me. And the other thing I wanted to say about data is that, and we learned this in setting up this new partnership, is that, but don't assume that policymakers and politicians are going to make their choices and decisions based on data or evidence. That's a whole other kind of field.
Other comments before we break?
Peggy.
Please.
Our examples of SAMHSA always, in terms of substance abuse prevention, they always have a list that community people can go to of evidence-based programs that, of all different types, not necessarily all big programs. And it's available and people know that it's a good source. So, it's possible to do something like that in the violence area. And there's a difference between data and the evidence-based programs. I mean, data helps us know how we're doing in terms of, is the problem getting worse? Is it getting better? And I agree that data is not useful to a lot of practitioners in the community. I mean, they like to know, are we doing better or are we not? But I think the evidence-based programs, getting those in a place where people know this is a good source, and I see that there are a number of different programs here that we could translate and put into our, maybe start in our communities. I don't think that's that difficult to do. We already had a workshop on where's the evidence. I can't remember what the title of the workshop was, but we could start to compile a best practices or list of programs and talk about what the evidence base is for those programs and make it available.
Go ahead. Go ahead, Elizabeth.
No, one of the things as well, Peggy, that I think is important is within those programs, there are often key components to the programs across different programs. And maybe an analysis of those key components and how they link back to the science is going to be useful, because the expense of integrating some of these sort of brand name programs is often very challenging, and the components can be implemented in a group and should have the same effect based on what we know from the science.
Jim?
And just to mention, that's exactly being done in the United States. We just released what we call technical packages, which are packages of the best available evidence for preventing child maltreatment and sexual violence for domestic purposes. But globally, I mentioned in my talk, World Bank, UNICEF, PEPFAR, the Global Partnership to Prevent and Violence Against Children are all working together, coming together with a package of the best available evidence for violence against children. So, but what this doesn't include, which is the other part that has been emphasized, is the implementation guidance. Okay, now we know it. How do you make it work on the ground? Which is also an important part of this that needs to be attended to.
And there are some fantastic, as you said, evidence-based programs. And if you tear into them, they're the ones that have done the best job of interpreting the data to the practitioner and the community. Another thing that would be really cool, this just popped in my head, if you've read summaries of journal articles, you always see the method, the outcome. Wouldn't it be cool if we got journals to require another section on cross-sector application to make the researchers think about how their research, which is often very, very finite, very siloed because of their expertise, to just begin thinking about application across sectors and how they summarize their research. And coming back to your point, Big, about the evidence-based programs, it's hard for practitioners who are working hard, as all of you know, as you do, every single day to get the job done, to wade through thick reports. Wouldn't it be cool if we just collected stories, anecdotally told, about how evidence is applied and has worked? I'd rather read a story than a 200-page report. Just a thought. Anything else? I'm sorry. Bonnie?
I just wanted a couple of comments about translating research to practice. In the elder abuse field, it seems that much of that is happening now in some limited ways, but I think a lot of the barriers to that has to do with funding. Where does that come from? And it seems in recent months, at least, there's much more of that coming from private foundations and partnerships with other constituents in the community. For instance, in elder abuse, much of the vulnerability comes through dementia in the senior population. And so, like the Alzheimer's Association supports translating those best practices in ways that then can be disseminated more broadly and in really useful ways so that they're more readily applied in small community projects, and I think in really successful ways. So I think engaging sometimes in more novel ways, some agencies or groups that you might not think of necessarily can be really helpful in doing that.
I love this conversation because I hear it very often, what the researchers need to do, what the practitioners need to do, and where the gaps are across all these groups. And I just tend to think that all of these approaches are necessary, but they're not sufficient in and of themselves to address the problem. So you need to have the peer-reviewed research and vetting through the journals so that we can make sure that the data has integrity and that it's reliable, and that programs that are based on those data, we can have a good degree of confidence that it's based on something fairly solid and that it's generalizable to the extent possible. You need to have people who have expertise and experience who can take that data, can crosswalk those silos and can take that data and interpret it, and you need to have those people who can take that interpretation and run with it. So if you think about a relay race and a really nice handoff, and that just kind of reminds me of what you said in the meeting in our group about having everybody at the table, and I think in kind of valuing all of the different ways in which we address these issues of violence, that if we have everybody at the table trying to figure out a common language so we each can tackle this problem in our respective spaces, but also come together coherently and cohesively to kind of to run the race together, to ensure that we're able to maintain the work that's being done on the ground.
There's a lot of people who aren't able to join us here today. A lot of people who weren't allowed to join us in the room today or couldn't, who probably have, I'm sure, some interesting ideas on how violence prevention can be infused, is addressed across the SDGs. So I'm going to encourage you to tweet, make contact, and let us know what those are, because those of us in this room can't possibly have all the answers. And so I just want to put a shout out to say we'd like to hear from you, even if you can't be here with us today, to share your ideas.
Any other comments before we break? I close this with just this question based on what we were just talking about. I wonder, and I don't have the answer, if we were to fill this room with 50% top-notch researchers, on the subject of violence prevention, and the other half with frontline practitioners from different sectors, the ones dealing with the victims and the potential victims and the communities. Would we have a very exciting day-long dialogue or a very quiet day? I don't know. So think about that, and we'll pick that up down the road some. We're right on target, so we're just going to take about a 10-minute break, and then we're going to get into the next session. Thank you.